Yep, you mentioned earlier this program would not be possible without the support of Novant Health Huntersville Medical Center. They are the presenting sponsor not only of this event tonight, but the whole week of our celebration of small businesses. We have here tonight Mike Riley. He is the president of Huntersville Medical Center. He's been a past board member for the Chamber of Commerce for 6 years, put up with me for 6 years, a graduate of Leadership Lake Norman, but a really close friend. And again, somebody, Novant has been a big supporter of small business and business in our community. I was talking to somebody the other day. They asked, what are the factors that any business looks at or people coming to the lake area? Well, first off, they look at the workforce. They look at education. They look at roads and infrastructure. But healthcare is extremely important, when they're making a decision about coming to Lake Norman. So, Mike, on behalf of the Chamber of Commerce, thank you for all your support. Thank you for what you're doing, and good to have you here.
I get Superman bumper music.
Yes.
That's fantastic.
Mike, let me tell you this, buddy. Thank you for being here. I really do appreciate it. We were going to have two doctors here. They were Bill's doctors.
Yeah, I was going to talk about that. Now, we were going to have Tom Batchelor. He can't say that. Tom's been my personal physician for 25 years, and again, I really enjoy that. And I do want to ask a question about that because that's one of the trends or changes in healthcare because Tom is working in a concierge care. It's a different kind of model. Talk about the introduction of that type of care because now, I'll be honest with you, when I was calling Tom, he was at a different provider, and you say, I need to come see Dr. Batchelor. Chances are you're not going to see Dr. Batchelor. You're going to see this registered nurse, and I'm not putting down RNs, okay? But you don't see Tom. You saw this RN, and now he's in a model. You want to see your physician? You can see your physician. Talk about the trends within healthcare.
Yeah, thanks. Thanks to all of you for having me today. And I like to
Mike's a little overwhelmed right now.
It's a wild room to be in.
That's
right
right.
now.
It is. It's tough to stay up right now.
You got me following a better Mike, and you got me following the senator. And Bill has told you already that I'm the replacement. So I've got 10 strikes against me already.
Hang on. Let's see if we can make it through.
So we talk a little bit about concierge medicine. So yeah, it's very true. Primary care doctors today, they have heavy loads. They see, depending on the doctor, 15, 20, 25, when they're really busy, 30 patients a day. And it's because they want to see everybody and they have huge panels of patients. What Dr. Batchelor has done is and Dr. Hamlin have kind of changed from where they're seeing, 20, 30 patients a day to where they've brought their numbers down to around 500 patients versus 2,500, 3,000.
Wow, that's a big deal.
Your typical primary care doctor sees 2,500, 3,000 patients in a year. Yeah,
wow.
And a lot of that happens. And I think if you're relatively healthy and you go in and you do your annual, that's no big deal. But if you have some health problems and you want to get some special attention, concierge medicine is perfect for you. And so that's what Tom's decided to do, and Carly, and it's and they're great docs. And that's the other part. They're very. I mean, Bill's really mad. He's acting happy, but he's really mad that Dr. Batchelor is doing this.
Right.
And the thing with it, there's a cost to it. So
Yeah.
the concierge medicine, you have to pay an annual fee, whereas if you have a primary care doctor, you pay for your visit, but you don't pay this annual fee. And it's so that you can get that special attention and all that comes with a doctor who has, a fifth of the number of patients that they ordinarily
How
have.
does that relate to the hospital? What changes happen if I have a concierge doctor? Is there any change?
Not really. And it's like if you
Because I assumed that doctors were kind of connected to the hospitals.
they are and they're not. They're most of your primary care doctors don't come to the hospital anymore. That changed 20 or 30 years ago. We have hospitalists who manage the care of the patient while they're in the hospital. The primary care doctor sort of manages the care of the patient while they're not in the hospital, and so we communicate and that kind of thing, but they don't dictate care and that kind of thing. That's really more done by the hospital. So if one of Dr. Batchelor's patients came to the hospital, they might call and give me a heads up, but they don't get special treatment in the ER or anything like that. We would, be aware of their presence, and maybe the president would come see him or something.
Right.
But I can't do anything for him. So
Okay, you stepped right where I want to go. So I did a little research on you, Mike, because I, unlike Bill, was happy that I got the president coming to the small business event. I prefer Mike Riley, the president of Novant Health in Huntersville, to be here. So I did some research, Mike. Although we'd met each other a few times, I didn't know. The Terminator gave me this information. Tell me if it's right. They said that you used to be a cardiac staff nurse. Is that correct?
It is correct. And for the record, I'm still a registered nurse. But if I go in your room with scrubs to take care of you, you're
So, but I found that interesting because that's a long way from administrator to president. Can you kind of, now you don't got to go back to 1962, but can you kind of walk us through? We're curious to know how a guy gets to your position. Kind of walk us through that. Oh, nice.
It's our back in time music for you, Mike.
Now Wilton is doing it now.
He's got it. He's got it.
I was born in a log cabin.
Mamie, he's starting to fit right in now. Okay.
Yep. You can just stay here at the table with us for the rest of the show. You're fitting right in.
So yes, I was a cardiac nurse. I started right out of nursing school at Presbyterian Hospital, and I really, I worked as a nurse, and I had no. If you had told me 25 years ago that I was going to run a hospital someday, I would have laughed at you.
Because administrative and service is night and day.
Yeah,
Well, it's different career paths too.
Yeah.
They don't usually align.
right. It really is, and it just I don't know if it's dumb luck or just I did a really good job. And one day somebody said, "Hey, you want to be the charge nurse?" And I said, "Okay." And then one day somebody
Little
said,
did you know what
Yeah.
that was, in charge,
Yeah,
right?
Right. And then one day somebody said, "Hey, do you want to be the house supervisor?" And I said, "Okay." And they said, "Hey, we've got a job in Matthews as a nurse manager. You want to do that?" And I said, "Okay." And during that process, I kind of fell in love with leadership. And I really, I think in healthcare it's a fantastic industry. Every day you can make a difference in somebody's life. And I think what I found was that as the cardiac nurse, I could take care of 3, 4, 5 patients and do a great job and make a difference in their life. But as a charge nurse, I had all 30 patients on the floor, and I could make a difference in them. And as a manager, I had more, and it just kind of grew and grew and grew. And then I like the thing of leadership that I really fell in love with is growing people. I love to watch people grow and see them do well. So that's kind of what did it. And I guess I just did, I don't know, you make me brag on myself. I did a good job at every level, and people said, "Hey, you want to do this?" And it wasn't until
You go ahead, beat your chest. That's what we do. That absolutely, you can do that. I tell people all the time in small business, if you're not ringing your own bell, nobody else is. So ring away, buddy. So you kind of walk where I wanted you to walk to, right? And so most of us sort of become leaders, and one of the things we do is sort of measure ourselves, right? Measure yourself. Again, the Terminator said you've been there since 2015. Give me an idea of what you think you could say. These couple of things, I'm really pleased that I was part of them. What does that look like?
Sure, yeah. So I've been at Huntersville since 2015, but with Novant since.
That Terminator's amazing, isn't it?
Yeah.
Sorry, you can't hide that.
I know. But I've been at Novant since 25. I just had my 25th year service award, so I've been there for a long time. But
no way, you don't even look that old.
Yeah, thanks. Yeah. I'm glad this is radio. Proud. So I've been almost 10 years now at Huntersville, and we've doubled in size. When I got there, we were a 75-bed hospital. Now we're a 151-bed hospital, so we've doubled. Increased a lot of the capabilities that we have. We have a 24-hour cardiac cath lab. We do STEMI care, which means when the community has a heart attack, they come to us. Those are two of the big things. We've got we opened our Martin Truex Jr. pediatric emergency room. Just so many. You're bragging about my, and it's not, it's not me. I didn't do all these things. I just happened to be there when a great team did a lot of these things. But those are just some of the things, and probably the thing all those are sort of growth kind of things. The thing I'm most proud of is the culture at that hospital. You know, it used to be we opened as a 50-bed hospital, and it's got that, and we've tripled in size since we opened, and we still have that community feel. And I tell my team, and
That's not easy to do.
yeah, it's not, because as you grow, we get more acute. Things get more and more, tense and difficult. I tell my team that, healthcare is hard, and if you do healthcare by yourself, it's really, really hard. But if you lean on the person next to you or the department down the hall or whatever, it makes it a lot better. And so that's what I'm probably most proud of, is the culture.
Mike, I can't speak for Dr. Batchelor, but I think he's like a lot of doctors. You can't work them 75.
Let it go, Bill. Let it go. You're going to find
He's
another
bitter.
doctor,
Bill's
write the
bitter.
check. Let it
But
go,
you,
Bill.
You can't
Bitter.
work them. You can't work them 75 hours a week, year after year after year, without it taking a toll. So I think the model that you're offering is something that really works for these docs. But I want to go in a different direction. Didn't we just celebrate 20 years of Novant?
20 years of Huntersville Medical Center.
Yeah. So my question is, what's the next big thing? I mean, 20 years right here, which, by the way, Joe, I told him I found the shovel. Okay, I was there at the groundbreaking of this facility when it was Presbyterian. I got the shovel. Matter of fact, I need to get that to you. But what's
You
the
do need to get him that. Absolutely.
What's the next big thing for Novant Healthcare in Huntersville?
Well, we're working on expansion again. Believe it or not, we just finished. We did a 44-bed expansion about 5 years ago, and now we're working on a ED expansion and a 24-bed observation unit expansion. We just continue to grow. Yeah, that's probably the biggest thing that we're looking at right now. It's interesting. You talked about when you were here in the very beginning. People who I talked to who were around Huntersville and the Lake Norman area back then, they said they laughed at Novant because they said, "Why are you building this hospital in the middle of nowhere?" And look at it now. Right. I mean, it's unbelievable how populated the area is and how crowded it is.
I studied and graduated in a hotel restaurant management, and so I used to tell people I could run a hospital. It's just like a hotel. Until my mother went to the hospital, and I realized what you have to do is 24 hours a day, and there's about 10 different reasons that 15 different people have to go into that room and take care of that woman's livelihood. It really is a genuinely, sincerely difficult challenge that never ends. As we're sitting here, there are people needing care that you are responsible for making sure that that's happening. I cannot stress enough how challenging that is once you think about it, right? I kind of just messed you up by saying that, right? Well, you're starting to think, I got to go.
But it's a great point. So, trivia question. Bill, I think you've heard me ask this before. And a typical patient stays in the hospital for 3 days. In those 3 days, how many different human beings do you think they come across? They are going in and out of the room. Not the nurse that goes in. It's just like Jeopardy.
Yeah, this is our trivia.
Oh.
Yeah.
So,
Wilton is on it tonight, isn't he?
Yeah, he is on it.
So not the nurse that goes in 20 times a shift, but how many different human beings do you think in a typical three?
I'm going to say 15.
I would say 20.
Okay. Bill?
I don't remember.
I've even given you this one before.
Yeah, I know. I can't remember.
It's 43.
Wow.
Oh, yeah.
43. So what I tell everybody, we have 43 chances to
in
blow
3
it.
days, yeah.
In 3 days, yeah. And so think about every interaction. And the thing that makes it more important, think about when you drive home today. Are you going to tell your wife or whoever about the person who cut you off or the person who let you in? You're going to talk about the person who cut you off. So if we get it wrong 1 out of 43, that's all they're going to tell the church about. And that's all they're going to tell their family about.
One thing I do recall you saying over and over and over is you really don't want people to stay in the hospital. Novant is more concerned with wellness, making sure that you aren't necessarily having to come down there. Can you speak about that?
Yeah, absolutely.
Because that's really a change in healthcare over the years, isn't it?
It is. And the way the hospital especially used to be is we would take care of you and then release you and good luck. And now we're so much more interested in, especially because, Novant Health and a lot of health systems are systems and not just individual hospitals. We want to take care of the entire you. And once you get out of the hospital, we want to put things in place and give you the structure that you need to not have to come back in again. We're there when you need us, but we don't, we would rather you didn't need us.
As you're looking towards the future of the hospital and healthcare in general, how does AI work into that? Because you're going to have the actual people, but not just AI, but like technology. So we see all these, robots and drones and stuff. Is that going to be part of it?
I think so. I mean, we have.
Is the robot coming in my mom's
It's
house?
coming in. Yeah, it is.
Yeah.
At some point.
At some point, it's going to come in and take her blood pressure. Yes.
Mike didn't want to say yes to that, maybe, but
I'm thinking I
You got
can't
him.
speak for him, but I think maybe that might be the way we're
But,
going.
I mean, we're already using it. So if you look at our ICU, we have doctors in house and we have nurses in house, but we also have video screens and AI that helps our physicians that are in a bunker somewhere. And it's amazing. It takes all of the patient's labs and vital signs and everything as they're actively happening, and it moves patients up to the top of their list as they get more and more critical. So that doctor in the bunker knows that he's got to take care of Mr. Russell first because he's the sickest, and then
because he's griping all the time.
could be. but it's amazing. And then we have our radiologists. They as they're reading X-rays, it goes through a machine and they're reading the X-rays, but the AI will show them a nodule or an imperfection of some sort. So that'll draw their attention to that. So that it keeps us from missing potential, diagnoses. So it's neat stuff.
So, Mike, evidence that you want to plug the hospital into the community is you're here putting up with us three tonight. So we thank you for that torture that we're putting you through. But talk about that, because for years you've been sponsoring
Very
stuff
involved,
at the chamber. Talk about why plugging yourself into the community is important to the hospital.
Yeah, it's critical. Think about when you move to an area. What do you look at? You look at schools and you look at healthcare, and it's so important that we're there for people. Everybody, whether you like it or not, unless you're going to need healthcare, and so it's important that we educate you. And I talked a little bit about how it wasn't just the hospital and it's the entire continuum of healthcare. It's important that we educate as much as possible so that before you get sick, you go see your doctor every year. So that before you have some horrible diagnosis, you get a screening so that we can find things before it's life-threatening. So it's being in the community is crucial for all of those reasons, and knowing that what we do and knowing that we're there, I think is comforting to people.
Not only is Novant the presenting sponsor of Small Business Week, they presenting sponsor of Leadership Lake Norman and Junior Leadership Lake Norman Mamie. The Junior Leadership Lake Norman program is for high school juniors, and invariably every year when I because I ask all of them when they graduate, which session or which thing stands out that you enjoyed the most, it's always healthcare day. Always healthcare day. Going over there, whether it's getting inside the helicopter that you guys bring out or going in and seeing some of the back end, they always enjoy healthcare. And I think you've had a couple of our Junior Leadership Lake Norman folks to intern down there, right?
We have, yeah, and that makes me feel good, Bill, because I usually give a little talk in front of the kids, and I tell these hilarious jokes. Crickets.
Mamie, I was getting ready to say I doubt he can deliver the punchline, but it seems like he figured that out.
I think you got it. I bet they're hilarious. This is not for that generation just yet.
They're not.
Yeah,
They're
they're not ready
quiet.
for it.
They
Yeah.
typically are quiet.
Yeah.
The funny thing I did one year I stood in front of them and I said, it's like Robert Kennedy said, and I did a quote and they all looked at me like,
Yeah.
and I said, Robert Kennedy, and they were like,
No.
I said, John Kennedy, the
No.
president, and they were but they hadn't had American history yet, not yet in junior.
Some of them haven't.
As a hospital administrator, with all the challenges facing healthcare, what are you most excited about on the horizon for healthcare?
Yeah, I mean, I think AI is part of it. I think that's exciting. I think we are getting better and better at a lot of things that used to kill patients. I mean, even things like hospital infections and readmission rates and the things that seem like basic blocking and tackling, they've been a problem in hospitals for years, and we're getting so much better at those. So I think that's there. I think yeah, AI. I talked about the doctor who sees the patients getting up. I think we're working on the same thing for nurses. We have they're not called bunker nurses, but nurses in bunkers who can help with things like charting. Charting is documenting everything is such a burden for nurses and doctors. we're working on that. So those are the kind of things that I think there's a huge nursing shortage, right? So if we can find ways to augment that nursing care where they can still get the same high level of care, but do it with less or fewer people that are physically there, I think that's great for us.
You said something at a Focus Friday recently that really struck me, and that was, Joe, during COVID, at the beginning of COVID, people were praising our healthcare folks on the front lines and really working. And then toward the end of COVID, they began blaming the healthcare, all the people working on them for their problems. I mean, speak to that, because there were some problems there.
Yeah, it's interesting how violence toward healthcare workers has skyrocketed during and since COVID.
Wow, I didn't know that.
Yeah, and in the beginning, and it's funny, I get stuff wrong all the time. I thought, oh, this is going to be like, remember 9/11? Everybody wanted to be a firefighter, go into the military, wanted to be a police officer, and I thought, oh, this is going to be healthcare heroes. Everybody's going to want to go to nursing school and go to med school, and it was nice for the first 6 months. We got lunch for free every day because everybody was so appreciative. But as time went on, and I think people, I don't think they intentionally said, I hate healthcare workers, but I think they associated COVID with healthcare and how terrible it was, and everyone was mad. And there were so many terrible things that happened with COVID, with so many people died and all that. And I think we the people who take care of the patients really kind of felt the brunt of that. And so we are seeing it's actually gotten a little better since COVID, but we saw dramatic increases on violence toward healthcare workers.
In my lifetime, that is the first time I've ever seen healthcare politicized on whatever side. It wasn't just about medicine or sickness. It was attached to your politics. So being in the middle of that just doesn't sound fun. You couldn't win.
It was.
Mike, this is a small business show, and so you're the hospital administrator. Tell me, what's the economic impact of Novant Huntersville Medical Center? How many employees, and what's the total economic impact of that hospital right here in our community?
Yeah, we have 1,200 employees, so that's we're one of the bigger employers in the area, and so I can't give you a number for economic impact, but between all of the employees that we have, the services that we give, we are pretty significant.
Yeah, oh, absolutely.
Hey, Joe, can you ask Arnold about that one? Our
I
economic
can.
impact.
I bet
The
you-
Terminator.
Ask the Terminator about
Ask the
that.
Terminator.
Ask the Terminator.
No, I do have a question though. If someone's thinking like, why should they go into healthcare? You said there's a nursing shortage. You guys do help people, and I know that's one reason people go into it. What's the big reason you think people should go into healthcare?
It's an easy why. Every day, whether you're a nurse at the front line or whether you're the finance guy in the back, you make a difference in somebody's life, and I think that's easy. And a lot of people say, "Oh, I don't like blood and guts," and I don't like, and every job doesn't have blood and guts, and so it's a great feeling to help people and to get
serving you better than
Talk just a little bit more about the process of becoming a nurse. Is it a 2-year program, 4-year program, 20-year? What if I wanted to do that? What's it take?
There's really two ways. There are 2-year programs like in a community college, and you get an associate's degree, or there are 4-year degrees through bachelor's degrees. My daughter is actually in her last year, or just finished her next to last year at App State in nursing school. So I'm trying to help the nursing shortage.
Right, that is great. Hey, one last question. Then we got to go. Let me see how to ask the question. So many people are viewing leadership in different ways, right? And you've already talked about your role in that. What advice would you give them on how to create a culture that they're looking for? Because we've already talked about it. That's not easy. Give them a tidbit of how you're doing that.
It's listen first, and even if you're a genius, you're only one genius, and the value of the people in the room.
You're only one genius. I love that. I love that.
And believe me, I'm not a genius, but the value of the knowledge in the room is so much more valuable, and will go so much further than any amount of wisdom that you may have.
Great. Thank
Mike,
you.
I want to thank you for being here, being the presenting sponsor. Joe, he's going to be on hand Friday. You're going to be on hand Friday at 3 o'clock. You're going to be presenting the small businesses to a business owner in Cornelius, Davis, Huntersville, Mooresville. Again, thank you for everything you do in our community, Mike.
Absolutely. Happy to be here.
Thank you, buddy.